Hi, my name is Wendy Fritz. I'm here at the West Michigan Cancer Center as part of the Survivorcise Wellness Series. I am an acupuncturist. I work out of the Acupuncture Center of Kalamazoo, and I'm here today with my model.
My name is Wendy Mitchell. I am the research manager here at the West Michigan Cancer Center.
So I wanted to talk about why patients may come for acupuncture, give you a little bit of background on me and how I came to work in this field. And Wendy and I will talk and get some questions answered for people who don't know anything about acupuncture and why you might consider that as a treatment option. And then I'll do a little bit of a short demonstration on what that looks like with Wendy, who's agreed to be my model. I have a background in nursing. I was one of the last graduating classes of Bronson School of Nursing. And then I, years later, was living in Chicago and went to acupuncture school. I have a master's of traditional Chinese medicine from Pacific College of Health Sciences. And then I got an amazing opportunity to work with Northwestern Medical Center's integrative medicine program. And they had a grant called the 360 program that put us in the chemotherapy suite. And I worked with a massage therapist doing acupuncture with patients who were going through chemo, starting at Prentice Women's Hospital with breast and oncology cancers. For a couple of months, we were about 2 half days a week, and the program just sort of exploded as patients and staff really responded positively to that experience until we were through the whole cancer program, serving their population. So that's a little bit of my background. And so things that patients commonly would ask for, because we don't treat cancer per se, we are all about in Chinese medicine helping take your body's natural healing resources and optimizing those to let your body become into balance. And so things that I work with a lot are peripheral neuropathy, GI issues, both during and coming out of different treatments. Stress and anxiety are big, joint pain, hot flashes and night sweats. So things along that line, chronic headaches, aches and pains, recovery from surgery, pain from that, helping the healing process, keeping the immune system boosted. And so that's kind of what people usually show up at my door looking for help with. And so I work with them to try and help those things. So generally, one thing patients want to know is how a treatment works. So if you are ready, I'll do a little demonstration on you.
Yes.
What I'm going to do is just clean off a frequently used spot. Mm-hmm. I'll insert a needle and then I'll let that needle rest. Usually in the clinic, we let them rest. We aim for about 20 to 30 minutes with most treatments, but I definitely work with each patient where they're at and what their body tolerates.
Okay.
So people often ask if it's sharp or painful, and I would say that for most people it's not. Everybody's sensitivity is different. Mm-hmm. Some people truly don't feel the needles at all, but some people do, and if you're not feeling well, sometimes you're more aware of what's going on in your body. I'll just clean off that spot here. The needles are super thin. It's not the needle that you normally would get with a medical treatment. How was that?
It did not hurt at all.
Awesome. So I tell people, when you're in a sort of more Western medical model, if they're inserting a needle, it's either to put something into your body or take something out. So those are 3-edged needles. They're meant to pierce. These are rounded at the tip. There's nothing in the needle. They're solid stainless steel. They're not hollow in the middle, and they're meant to separate the skin cells rather than pierce them. So now, while that's inserted and you're letting that do its rest period, are there questions that you?
I do. So you mentioned that you work with breast cancer patients.
Mm-hmm.
So we know that frequently women who have been diagnosed with breast cancer end up getting lymph nodes removed. We often tell women to not have any procedures done in that affected arm. So my question is, are you able to do the acupuncture into that affected side?
Generally, we don't. We will avoid that arm. We'll just use the opposite arm. We can use points on the ear that correspond to that arm. We can use points further away on the body to do anything that we want to, like if there's, we're worried about lymphedema, to kind of manage that without actually going into that affected arm.
So we know that some chemotherapy agents can cause peripheral neuropathy. Do you generally want to see those patients knowing they're going to get those medications before the neuropathy develops?
Yeah, ideally, we like to see them beforehand. That was one of the definite bonuses of the 360 program at Northwestern, being on site at the chemotherapy suite. We could get patients before they'd had their first agent, or while they were getting that first agent, and we worked in a preventative measure, so they could complete their treatment protocol, and try and keep that neuropathy at bay, or at least keep it at a low level, so they could get through treatment.
Okay. So one side effect that patients do mention frequently is insomnia. They have difficulty sleeping during treatment, whether it's due to steroids or stress. Tell me a little bit, does acupuncture help with that?
It can help with that. If it's insomnia from steroids, that's a pretty tall order. That's a tough one to get over. But we can still do things to address it, and hopefully get some hours of sleep in there. Stress and anxiety, definitely something we can work with. From our model, there's several different things that can contribute to insomnia, so we just approach it with what each individual is coming to us, what their picture looks like, and then we develop a plan for that, and try and get them sleeping again.
Mm-hmm.
I know that's super important to the healing process.
Yes. So a question I know patients will frequently ask me is, does insurance cover the cost of the acupuncture?
So that's changing a lot. About a year ago, Medicare started covering acupuncture for low back pain, and now insurance companies, that's started the ball rolling. Most acupuncturists don't bill insurance. At our office, we have a receipt that has coding on it that insurance companies look for so that patients can get reimbursed. But there are more and more insurance companies that are covering it, and health savings accounts almost always, people can use those to pay for acupuncture treatments. So it's a little help, but we take every bit we can find.
And how often would a patient come to you for treatment, and how long would those treatments last?
So it's everybody's favorite answer. It's variable. Things that just crop up that you've had for a couple days or even a couple weeks. Sometimes it's just 1 to 2 treatments to kind of get that settled down. More chronic things take longer. I typically tell people plan on about 6 to 8 treatments. But you don't have to sign on for that whole 6 to 8 treatments. Usually, if you're going to respond to acupuncture, that first 1 or 2 treatments, you'll know things are moving in the right direction. And then for length of time, typically the first treatment is a long one. We like to look at the body as a whole. So to find out why a patient would be coming in, but then I ask a whole bunch of other questions and kind of put a whole picture together to try and get down at the root of what's causing these unwanted symptoms. So that first treatment is usually about an hour and a half to 2 hours. After that, it's usually about an hour. We get the needle in like you have. I use typically the lower arms, the lower legs. Those are the most common sites. There are acupuncture points all over the body, but sort of the stronger points that we use are elbows to fingertips and knees to feet. And so it's usually anywhere, and it depends on the person's sensitivity as well, anywhere from 6 to about 20-25 needles. It can be more than that if they have a lot of pain that's dispersed over the body, but we try to keep it no more than 20 to 25 needles. And then they stay in. I shoot for 20 to 30 minutes, but again, I can individualize that. Somebody who's super sensitive, I have some patients who just know they're done at like 10 to 15 minutes, and so that's fine, and that works for them. There are some things that we use points on the ears for, or more chronic long pain with people who are in a more, feeling pretty strong and healthy. Their needles might stay in for 30 to 45 minutes. We work with patients who want to quit smoking. And for them, if they're ready, acupuncture can be this great tool to help them turn that corner. But those needles stay in for probably 45 minutes to an hour. So it kind of depends on what we're treating, but on average 20 to 30 minutes. With the whole treatment taking about an hour. And that's a check-in, see where you're at, put the needles in. Sometimes there's other therapies that I'll employ that are, just take a couple minutes after the needles come out, and then we just close up, and that's where the session ends. So now that needle's been setting there, how are you feeling?
Fine. I honestly don't even realize it's there.
That's awesome. And that's typical. Things that patients will describe to me are, some people just don't feel anything once that needle's in, and anything they do feel when I'm inserting it, it just kind of like a wave, it just kind of goes back out. Some people do get a feeling of heaviness, some people get temperature changes, some people get sort of an achiness that moves around, or a feeling of energy moving around, but pain is definitely not anything we're looking for. We are not of the no pain, no gain school, for sure. So a point like that I would use often for, it's a point that directs energy down. It gets used a lot for pain, especially headaches. It's a point that gets used for fighting off, if somebody's coming in with early symptoms of a cold, that gets combined with some points around the neck, other points around the wrist and the crook of the arm, to help try and move that virus through quicker. Like I said, it's combined with some other points for pain a lot. It's part of a protocol that I don't use a lot of protocols, but there are a couple point combinations that I use frequently for hot flashes. So it's got some varied purposes.
Which would be helpful in our breast cancer population as well.
Yeah, that's one of the things I commonly...
And our prostate population.
Okay. Yeah, I didn't know.
Yes, yeah, our prostate cancer patients definitely report hot flashes with some of the treatments that are given, so that might be a benefit as well.
Yeah, absolutely. And it's something that responds pretty well to acupuncture for most people. Some things are trickier, but that one seems to respond pretty well. So no pain so far.
No pain.
Awesome.
No. So a question the patient might ask, or I might even ask too, is do you use new needles every time for a session?
We do. Most states require now that we use disposable needles. In the early days of acupuncture coming to the United States, they would try and autoclave them, but they're so tiny that the metal breaks down and you get burrs and they're not very comfortable. So we stick with disposable needles. So they're sterilized, individually wrapped. When we get them, each person, the needle's only used once, and then it's disposed of in a needle box.
Are there any side effects to the treatment?
So things that you can possibly have, some people, especially on the first 1 or 2 treatments, will get a little dizzy, a little woozy. I know I was taught that some people will faint. I've done this for 18 years now, and I have never had anyone faint on me. You definitely want to go with somebody who is licensed. Most of the states now require you to be licensed to perform acupuncture, which is a great safety measure, because potentially you could puncture an organ if you don't know anatomy and you're not trained. That's a very rare occurrence, but it's potentially there. It's a reason to go with somebody who has the proper certification. The other things are bruising. Occasionally, most spots don't even bleed, but occasionally you'll get a drop of blood or a little bruise. Some people get really relaxed. So I have patients who will only come in the evening because they know they are done once they have their acupuncture, so they'll go home and go to bed. I have some people who actually get energized by it. They're in the smaller category, but it does happen. Some people get a feeling, especially in those first 1 or 2 treatments, of euphoria. So those are common side effects. And then the only contraindications really are if somebody's in treatment, if their absolute neutrophil count is really low or their platelets are really low. If definitely they want to check in with their doctor and get the okay. And we try to avoid when their counts are really low. We try to avoid acupuncture, and for them, I do things more like use essential oils on the skin and do acupressure. Blood thinners are not a contraindication, but we definitely want to know if you're on them. I've never, and again in 18 years, I've never had anyone have a problem with bleeding, but we watch a little closer. We use a little extra pressure, and we're a little more cautious under those circumstances. And then emergencies, I would say acupuncture can do a lot, but if you're having heart pain, if you're having trouble breathing, if you've broken a bone or are bleeding actively, you don't want us. You want an emergency room. That is not our place.
Mm-hmm.
Do you have any other questions?
I don't think I do.
Awesome.
Fantastic. Thank you.
Are you ready for me to take the needle out?
Sure.
This is my handy dandy little travel.
Oh.
And that's that, and I'm going to put that aside for the trash. Thank you for being my model.
Well, thank you for inviting me.